Chronic diseases in the U.S. are growing at a rapid rate. Not only is that upsetting for the affected people, it also means rising healthcare costs for everyone. Many employees have tried offering health and wellness programs but aren't getting much participation. So joining me now to discuss their pilot wellness program, we have Nabayu Ababa, the Director of Health and Wellbeing at Sodexo, along with John Cardone, who is with the YMCA of Central Florida. Gentlemen, I want to welcome both of you to Daytime today.
Good morning.
Good morning.
So let's talk in general. How serious of a problem really is chronic disease here in the U.S.?
Chronic disease is a major problem in the U.S. According to the Centers for Disease Control and Prevention, 117 million Americans have one or more chronic diseases, and that's what's driving our national healthcare spend, which now is at 18% of our nation's GDP and expected to rise sharply over the next 20 years.
Okay, so let's talk implications for the U.S. economy and really specifically for employers in this case.
Sure. So, as I mentioned, currently we're spending 18% of our nation's GDP on healthcare, and that's only going to continue to rise unless we can really come up with a comprehensive solution for improving the health of our nation. And so Sodexo and the YMCA of Central Florida, we came together to really come up with a new model for delivering preventative health solutions at the workplace and community setting.
And I think from the workforce's perspective, we know that if our employees are unhealthy or they're not motivated, that can increase absenteeism, that can decrease their motivation. And again, most importantly, I think what we're really focused on is driving down their overall healthcare costs.
Okay, so now that we know that kind of most of these healthcare workplace programs have failed, we want to know what sets your program apart and tell us kind of what results you're seeing thus far.
Well, I think we can tag team this one. I think that what we've really tried to develop is the non-traditional model. Typically in the worksite wellness, it's an offering to a YMCA membership or to a gym membership. And we know that only a small portion of the population or the employee base will take advantage of that. What we've really done is we've really come together because we're both cause-driven organizations and have really developed a comprehensive approach for this initiative.
Right. So I think the key differentiators is the fact that we have this powerful partnership that allows us to provide evidence-based, strong programming at the workplace setting and in the community setting. So we make the healthy choice the easy choice, no matter where you are. And then we also have strong programming. But before we connect employees to the programming, we make sure that we connect the employees to the right program after they get screened and understand their personal health status. We also incorporate outcome-based incentives, so we incentivize people along the way for making the healthy choice. And we also have great long-term support that we provide employees in the YMCA's health coaches and lifestyle coaches and Sodexo's registered dietitians.
So you're making it easy. You want the healthy choice to be the easy choice. Do you think that's why those other programs have failed? They've been a little bit too much work, maybe, so to speak, for these employees?
I think that's a really good point. I think it comes down to access. But access for individualized programs. This is not a traditional fitness program, and one of the differentiations of both our organizations that we don't have a traditional fitness exercise specialist. These are really people that are specialists in behavior, and it's meeting these individual employees where they are versus just prescribing a program and then checking in with them. And it's a long-term commitment. We've been at this a year. It's a 3-year pilot. But we know that it's going to take a long journey to engage these employees so we can sustain their lifestyles, not only as individuals, but their entire family.
All right. Lastly, where can we send our viewers to get more information about really the health and wellness programs here in our area?
Thank you.
Sure. We encourage your viewers to visit SodexoInsights.com. That's SODEXO Insights.com to read a case study on the Communities for Health program and to really understand the nuts and bolts of this innovative initiative, which is a featured article in our 2016 Workplace Trends Report.
All right. Lots of great stuff today. I want to thank you both for being with us.
Thank you.